Hi, everyone, and welcome to the first webinar as part of the Elevating the Medicaid Enrollment Experience Project, or Emmy, covering Administrative Advocacy 101. My name is Jennifer Wagner, and I'm the Director of Medicaid Eligibility and Enrollment with the Center on Budget and Policy Priorities. Today, we will give you a brief introduction to the Emmy Project, and then my colleague, Suzanne Weichel from the Center for Law and Social Policy, will discuss administrative advocacy, including the importance of benefit enrollment, what is administrative advocacy and why you should be involved, a look at state choices that affect Medicaid administration, examples of administrative advocacy successes, and strategies for effective administrative advocacy. All participants are muted and in listen-only mode. If you'd like to ask a question, please click on the Q&A icon in the control panel at the bottom of the webinar screen and type your question into the box. We will be monitoring the questions and will pause for Q&A at the end of the presentation. So please ask questions whenever they arise. Now, to get started, we're going to have a quick poll. We'd like to know how much you've engaged in administrative advocacy in the past. Is it never? Do you dabble but don't have the time to commit to it? Are you engaged quite a bit, but there's always room for more? Or should you, in fact, be giving the webinar because you're so deep into administrative advocacy in your state? All right, we'll wrap that up in just a minute and then check out the results. Oh, great. We've got people with a lot of different levels of experience. Great to see people who are always eager to learn more. Next, I'm going to tell you a little bit more about the Emmy Project. So the goal of Emmy is to support administrative advocacy on the state and national level to help eligible individuals enroll in and stay enrolled in Medicaid through improvements to policy, operations, and technology. It's part of a larger CBPP effort to simplify and streamline access and coordinate across programs. So though it's focused on Medicaid, it considers ways to enroll families in the full package of benefits for which they're eligible, and will cover a lot of topics that are generally applicable across multiple programs. There's a series of webinars and papers that we'll be producing through Emmy. Some will be on things like administrative advocacy, like we're covering today. We'll also take some deep dives into Medicaid policy, discussing applications, renewals, and non-MAGI policy and opportunities for streamlining. We'll also touch on some innovative topics like human-centered design, bringing in some of our partners to talk more about these areas. We'll cover timely topics around COVID-related things, like as the continuous coverage provision may end and states transition out of different waiver flexibilities. Emmy is geared towards both new and experienced advocates. So we've got 101 series, like today, that are meant to be kind of an introduction to concepts for people who are newer to Medicaid or switching over to administrative advocacy from some other work. But then many topics will have a 202 series that's for a deeper dive into these issues. That'll get deep into the policy as well as have more opportunity for discussion and peer coaching. Please check out our website where you can sign up for updates for the project. We also have a great number of papers on there from CBPP and other of our partners talking about eligibility and enrollment issues, from deep policy to more general topics and cross-program enrollment and all kinds of interesting things. We'll also be posting on that website recordings of webinars like today, as well as the slides used. So if you want to share that with colleagues or other people who are interested, that will all be put up on the website after today. And finally, Emmy is a new effort. We want it to be as helpful as possible for you all, and we've got a lot of flexibility to produce content that's useful. So please give us feedback after today or any time throughout the project on how we can more effectively help you and support you in your efforts. So thanks so much for joining us, and now I'll turn it over to Suzanne.
Great, thank you, Jen. And good afternoon to everyone, and thanks for joining us today. I am Suzanne Weichel. I am a Senior Policy Analyst at the Center for Law and Social Policy, and have been working with Jen for a number of years on projects around administrative advocacy. And so it's delighted to be here to chat with you all today, a little bit about what we've learned and kind of helping launch this project that's exciting. So before we get too deep into it, I just think it's important to always take a step back and remember why that we're doing this work. As we all know, as Medicaid advocates, that Medicaid works. It's a great program. It covers 1 in 5 Americans. It serves diverse populations. It's critical in terms of child development across the country. It covers nearly half of all births. 83% of children who are poor are insured by Medicaid, as are 45% of non-elderly adults with disabilities. And we know that it provides not only access to care, but financial security and overall better health outcomes, which is great. And it's such an important program. But what we also know is that there are still a lot of people out there who are eligible for Medicaid and they are not enrolled. I was able to find some data from 2017, which is a tad bit dated, but I think it still rings true and is important to highlight that of the uninsured population, about 25% are eligible for Medicaid. And so when we talk about administrative advocacy as an avenue to Medicaid enrollment, I think we really need to think about it as, a way to reach people who are having trouble connecting with a program for which they are already eligible. So what do we mean when we say administrative advocacy? And you can read what's on the screen, but I really want to reiterate that what we're talking about, particularly as part of the Emmy Project, is that we're talking about the state rules and processes of the application, enrollment, and renewal process for Medicaid. And today, while we're focused on Medicaid, I want to be clear that much of what we talk about is relevant to other benefit programs as well, such as SNAP, TANF, WIC, and child care. And that part of the work around Medicaid of streamlining and simplifying through administrative advocacy is to make it easier to coordinate across programs so that families are able to more easily access the full package of benefits for which they are eligible. So just to be clear about what we're not talking about when we talk about administrative advocacy is that we're not talking about legislative work. We're not talking about expanding eligibility through the legislative process or other legislative changes. Obviously, that work is very, very, very important. But what we're really focusing on today and throughout this project is the focus on the implementation of the legislation to expand coverage or whatever else may be done legislatively to expand access. And I also just want to be clear that there's more work around administrative advocacy that we're not specifically touching on today. So particularly in recent years, there's been a lot of attention paid to things such as submitting public comments on waivers, on proposed federal rules, or otherwise building an administrative record. And that certainly falls into the administrative advocacy bucket. It's a very important part of that bucket, but it's not the part of the bucket that we are talking about today. All right, so now that we all know what it is, I think the question is, why should we be engaged in this work? Why should we use our limited time, our limited resources as advocates and advocacy organizations to make sure that administrative advocacy is a priority in our work? And when I think about this, I think it really boils down to 3 buckets. One is that, how easy or cumbersome the application and enrollment process is because of decisions made by states or by counties in the states where programs are county administered. Also, I think this is a core component of racial equity work. And I think it's very important in terms of how it plays into people's perception of government and what that means, beyond just health insurance and being enrolled in Medicaid. So we're going to dig into each of these a little bit more. So first, thinking about decisions, states, and like I said, in some states it's counties that are making these decisions, just make a lot of decisions about how programs are administered. These decisions affect the application and enrollment experience for people and whether they're able to enroll in benefits that they're eligible for. And I keep saying that because I think it's really important to understand that, people are eligible. We're not talking about, expanding eligibility, which I think can sometimes be a bit more debatable among different populations or different groups, but we're really talking about if somebody's eligible for a program, they should be able to enroll in that program. And the decisions that states or counties are making affect whether or not that's possible. And I think, we all think that in an ideal world, when legislation is passed, it's implemented and everything works out as it should and perfectly for everyone. But unfortunately, as you all know, we live in a less than ideal world, particularly in 2020, and that the implementation of the policies don't always go as intended or planned, right? So let's say you pass Medicaid expansion or the IKEA option, and it's great that that eligibility is there on paper, but unless the implementation and the choices that the state or county makes allow people to easily, successfully enroll in that coverage, the impact of that legislative change will be diminished. So when we think about some of the questions or decisions that states and counties make, we'll go through some here. And just to be clear, we're just like throwing these out there. We don't expect people to know all the answers to these. We don't expect you to sit there and tick through all these in your head and think, gosh, I don't know all the answers. Like, this is really just to kind of get you thinking, and also to think about, if you don't know the answer to these questions, who might, what partner organization might know these questions, or who could you reach out to learn? So first, like, what happens when somebody calls the call center? How quickly are those calls answered? Who answers those calls? Is it somebody who can actually address the issue at hand that somebody is calling about? Or is it somebody who basically takes a message and sends the information to somebody else to call the caller back and gets into a game of phone tag? Are callers able to complete an application with a telephonic signature? And for Medicaid, they certainly should be able to, but for other programs, this varies more, and that's a really important decision point. If they need an interview, again, typically for non-Medicaid programs, will it occur right then? Will they have to schedule an interview for a later time? How does that work? And then lastly, what hours is the call center available? Is it available, in evening or early morning hours, or is it only available during typical business hours? Also, how long is the application and what questions are asked, and are they worded in an inviting manner? Oftentimes these applications are just kind of added to over time without a thorough review of the entire application. And we've heard of situations where a state thinks they need to ask a question because of a federal requirement, but perhaps that federal requirement has been changed or withdrawn, and some of those questions may not be necessary. And then also, is the wording really clear? Is it confusing to read? Is it understandable? How easy are the questions to answer without getting confused? And then notices. We hear about notices a lot from advocates and the difficulty with understanding those. So are written notices to applicants and enrollees clear and easy to understand? What reading level are the notices written for? How many languages are they available in? Are people able to receive them in their preferred language? These are all things that, have a great impact on whether or not somebody is able to complete the enrollment process, and particularly the renewal process at their redetermination period. And I'm sure that we're going to get a question about, can somebody share an example of a great notice, which is a really excellent question. And what we kind of always say is we don't have a really great notice to share, but we're hoping that soon we'll have better notices out of states to share, because I know that there's a lot of projects going on in different states working with between advocates and state agencies to rewrite some of those notices. And how are electronic data sources used? States make a lot of decisions about how to use electronic data sources, and it boils down to things like which data sources are they using to access to verify incomes? For example, are they using the quarterly wage data, the work number, something else? All of these different options have different pros and cons. Is the state using data from other benefit programs? Are they looking at the data in the SNAP program or other programs? What are they doing during that 12-month determination period? Are they, checking data sources behind the scenes to try to, quote, like, catch people who may appear ineligible at the time? And is the state being overly aggressive in their use of data sources, or are they kind of using them appropriately and, to the benefit of clients as much as possible? And then when we talk about paperwork, which is often called verifications in this space, how often do people have to gather and submit those verifications to the agency? Are they things that the agency could get electronically otherwise, but they're asking people to track down and send in? Are they asking for the same documents, such as residency, to prove residency every time they apply or renew for the program? And how are people able to submit that paperwork? Do they have to use snail mail and send it through the postal service? Do they have to use a fax machine? Do they have to bring it in person? Are they able to email it? Is there an app that they can take a picture and upload the verification to? Can they use any of those methods? Is there something else out there that I haven't listed as a possibility? This is all stuff that really helps or hinders people's successful application process. And then lastly, what happens when someone walks into an assistance office? Do they need an appointment before they can talk to somebody? Will they be able to talk to somebody that day? How long will they wait? Does an office only allow a certain number of people in every day before they essentially close their doors for the day? And what hours are those offices open? And again, I just want to reiterate, the point here is not to overwhelm you with questions, but to provide some concrete examples of the decisions that states make that are, for the most part, entirely at their discretion, and literally define the experience for people when they engage with the state to apply for benefits. And like I said, while some of those are unique to Medicaid, most of these questions can be asked across all benefit programs, which is really important because we know that when people are able to access all the benefits that they are eligible for, it improves their lives, their health, and their financial security. And this was not an exhaustive list of questions. So if you're interested in digging more into this, certainly reach out to us and we can provide you with even more examples. Okay, so the second reason of why we think that you should be engaged in this work. So I think what I said earlier, this really boils down to it is part of the racial equity work. So I think some administrative issues or decisions are blatantly and easily identified as racist. And I think one of the best examples of that is in recent years, the implementation or request for work requirements in the Medicaid program and the disproportionate impact that has on communities of color. But I think it's really so much more than those obvious examples. Systemic racism over time has prevented people of color from receiving equitable education. And when you combine that with things like implicit or explicit biases of hiring managers, along with other factors, this results in higher unemployment, higher underemployment among people of color. And relatedly, we know that people of color are overrepresented in low-wage jobs, such as retail and service sectors, and that those jobs are less likely to offer health insurance benefits. And all of this combined leads to less access to employer-sponsored insurance and disproportionate eligibility rates for Medicaid. And I referenced some data earlier that 25% of the uninsured population thereabouts is eligible for Medicaid. And when you dig into that a little bit more, it shows that of that 25%, 21% are Black and 26% are Hispanic, which is clearly showing that those populations are overrepresented in the population of people who are eligible but unenrolled in Medicaid. And just to give another example is, because people of color are more likely to be underemployed, working multiple jobs, when you think about the paperwork you have to turn in for income verification programs, if you're working 2 or 3 jobs, that looks really different than if you're working 1 job, and these things I think just add up. And then I think, we know that Medicaid is one avenue for reducing health disparities, and it's a very important avenue for that, but it's only as effective if people can actually get and stay enrolled. And I think the more hurdles that we put up to the enrollment and retention process means fewer eligible people enrolled, which is disproportionately leading to more uninsured people of color, and it really hampers Medicaid's ability to work as a tool to reduce health disparities. And then I'm not going to spend a lot of time on this, kind of the third bucket of why I think you should be involved in administrative advocacy, but I think, there's this growing body of research showing that the more complicated or confusing or burdensome someone's interaction with government is, the less likely they are to be civically engaged. And so I think some people could argue that this is a little bit tangential to our core conversation today about administrative advocacy and getting people enrolled, but I don't think it's that tangential, and I think it's an important point for advocates to keep in mind, that the experience that people have with Medicaid or other programs really, has effects in their lives outside of whether or not they're able to go see the doctor. All right, so moving on a little bit to successes. So I mentioned over the past several years, Jen and I have had the opportunity to work closely with advocacy groups in several states as a part of a project that focused on administrative advocacy for both Medicaid and SNAP. And throughout the course of that project, we learned a lot about obstacles and we saw a lot of successes also. So some are listed here on the slide. I just wanted to give a few more concrete examples in that in one state, advocates were able to identify a glitch in the computer system, the actual programming of the eligibility and determination system, and fixing that glitch around, I believe it was around income counting, meant that up to 6,000 more families were being automatically renewed for Medicaid each month versus having to manually fill out paperwork and submit that back to the state. In another example, after kind of going through and taking note of which verifications or paperwork applicants were being asked to submit, they were able to come to agreement with the state that a lot of those were unnecessary, and they didn't need to be sent out. And that meant at the end of the day that 70,000 fewer requests for verifications were going out to Medicaid enrollees, which is about 8.5% of Medicaid enrollees were receiving fewer requests for documentation, which I think is pretty significant. And we've also seen just the importance of improving the timeliness and application processing. And here on the slide, I have a couple comments. The second bullet talks about ensuring that the state is appropriately applying their reasonable compatibility policy. For those of you who may not be familiar with that, that's a rule around kind of attested income versus what the data sources say. Jen is a reasonable compatibility guru, and if you're interested in learning more about that, she has lots of resources that she's provided that we can point you towards on that. This slide has some other examples. I think improving the coordination between Medicaid and other programs, including ensuring that a negative action on another program doesn't result in an automatic negative action for Medicaid. So, for example, if somebody doesn't return their interim report or renewal paperwork for the SNAP program, that shouldn't result in an automatic disenrollment from Medicaid. But it turns out that was happening in one state, and advocates were able to identify that and fix that. Improving the rate of ex parte renewals. I'm sure many of you on this webinar are familiar with ex parte renewals, but for those of you that aren't, this is the term for when a case is automatically renewed based on information available to the agency without the client having to take any positive action. And rates of ex parte renewals vary widely across states, and one of the things that we've learned over the past several years is that in order to really understand why something like ex parte renewals may not be happening as frequently as you think they should be, It's really important to dig into both the policy as the state has it and the state is administering it, and the IT system issues. For example, in one state that we were working with advocates in, the advocates learned that any Medicaid case that also had a SNAP case was just automatically disqualified from the ex parte process, essentially eliminating a large chunk of Medicaid participants from even being considered for an ex parte renewal. And as a result, all of those people have to instead receive an enrollment packet, fill out paperwork, make phone calls, take a lot more action on their end. And I do want to note that we are going to have a paper released soon that kind of details a case study of that issue, which we'll be sure to share with the Emmy listener. And then, as I mentioned earlier, improving notices sent to enrollees and reducing the number of notices sent to enrollees. All right, so how do we get to these successes? I think that this is very hard work. I think it can be extremely rewarding work because it can have profound and really large impacts, but it is hard. And it presents a lot of obstacles that I think we don't typically encounter in our legislative advocacy work, and therefore many of the traditional advocacy tools that we use aren't really usable in the administrative advocacy world, and we have to adapt our approaches and how we go about things. At times you may feel like you're hitting your head against the wall, and that may be an appropriate feeling, but it can be overcome. So thinking about administrative advocacy versus legislative advocacy and how they're same and how they're a little bit different. So obviously persuasion, right? This is basically the definition of advocacy. This is literally, the essence of what we do, trying to persuade people. That's totally the same. We have the same end goal. We want more people enrolled. We want more people to be able to access Medicaid. We want more people to be healthier, to have all the resources that Medicaid provides. And the data part, I think, I think, unfortunately, very little policy is truly driven by data, but I think we can all agree that solid data should be guiding all of these advocacy efforts in both realms. So the things on the left, core to advocacy work and our work and any advocacy effort, and then I think when you get into the administrative advocacy sphere, you quickly realize there are some significant differences that I think are just important to name, because I think although we may all know this at some level, I think it's one of those things that until you say it out loud and you really think through it, it might get kind of lost in terms of when you think about how to go about this work. So oftentimes I think in legislative advocacy, it comes down to things like vote counting and like what deals do you have to cut to get the votes, and what, compromises do you have to make, or finding your leverage points, or strategizing which legislative committee to run things through, or, preparing talking points for champions on a floor debate. The list goes on. But the point is that these things just really aren't particularly relevant to administrative advocacy. And I think the second bullet point on the right-hand side of the slide is something that is really worth saying out loud. That there's when you're doing administrative advocacy, you may sometimes be trying to convince a political appointee, such as an agency secretary, or maybe the governor herself, an elected official. But I think most of the time the administrative advocacy work is going to be with people who are not elected officials. They're often career employees at the state. And to just say it really simply, their motivations and priorities are different because of that position that they're in. For example, you don't have the option to do an e-blast to their constituents in their district because they don't have constituents in their district. An editorial in their hometown paper to kind of call them out publicly isn't really an option. So we have to think about other ways to get there. And I think we should all assume that people running Medicaid and other programs are super well-intentioned, they believe in the power of the programs, and to give people a helping hand. But the reality is that they're also incredibly understaffed and often pulled in 1,000 different directions I think for us, what that means is that we just need to approach the work differently than you would with an elected official. So, you know, it's important to deliberate, to think about how you're modifying your usual tactics and strategies, and how you're thinking about your policy goals and framing those goals in a way that's going to be more effective with people in those positions. So when you think, if you have a policy goal of reducing churn, you know, maybe you would talk to legislators about that in one way, but when you're talking to administrators, you might think about it in terms of, you know, it reduces work for the agency staff, which allows the staff to have other time to perhaps address a backlog. Maybe they've been under pressure from CMS to address that backlog, and so helping them find a way to get to their end goal of getting out from under the pressure of CMS, but to also get to your end goal of reducing churn. You know, just thinks about framing that just a little bit differently than you might otherwise. And I think lastly, the public message can be a lot harder. So oftentimes administrative advocacy, just by its nature, gets very weedy very quickly. And I don't think that makes for the best public message. So I think really thinking about how to complement the work you're doing directly with state agencies on very weedy issues while also promoting a message in public that reinforces what you're saying, but at a much higher level, can be very effective. All right, so obstacles. So I think there's a variety of obstacles that are going to vary across your state. And I just want to say I recognize wholeheartedly that everyone on this webinar is sitting in a different state with different political context, with different shades of blue and different shades of red and some purple mixed in there. And that, you know, this is all, some of this is going to be more applicable in some states than others. But to some degree, these are obstacles everywhere, and overcoming them, you know, is critical in order to move forward in this work. So data, I think this is, you know, essential to developing strong policy, to understanding where the barriers truly are. But it can be difficult, you know, to get data on such things as denial reasons, ex parte rates, churn. Most states aren't measuring churn, data broken down by race and ethnic groups. I mean, in one state that we were working in, advocates were even having trouble just getting, you know, current and accurate enrollment data, just literally enrollment numbers. So I think that, you know, figuring out what data you need and figuring out how to get to that data is going to be step number one. And then agency culture or resistance to change. You know, I think sometimes if a program has been run the same way by a lot of the same people for a long time, it's hard to change that as an outsider. I think, you know, it's really hard to kind of knock on somebody's door and say, I think you should be doing it differently. And this happens, I think, to varying degrees everywhere. And I think it's just important to think about, you know, one, to expect this and to think about how to get through it, but also, you know, if this is really becoming an obstacle that's very difficult to overcome, can there be pressure put on from, you know, the higher ups in the agencies, the elected officials that do have more of a constituent to respond to? And then priorities of the agencies. Agencies have a lot of priorities to pull them in different directions. And right, ultimately, it's our job as advocates to ensure that the issues preventing people from enrolling are the priority of the agency. But as part of that work, it's important to realize and keep in mind that agencies deal with a lot of different things that I think most advocates don't even realize are going on. And I think this is especially true in the time of crisis. For example, in 2020, in the past 6 months during the COVID pandemic, agencies have dealt with really new and difficult things, such as moving their entire staff to remote operations, an influx of enrollment, and adhering to the MOE that currently prevents disenrollment. So, you know, these things all take a lot of time and resources from the agency end, and I think as advocates, we just need to recognize that, you know, there are times when the agency is responding to crises, and we need to give some grace and be understanding of that. The fourth one there, the IT capacity. So I think this is something that advocates often don't anticipate being a huge obstacle, and then it often actually is a pretty large obstacle. So states often have contracts with their IT vendors, such as Deloitte or Accenture, some of the bigger ones, that only allow for a certain number of IT maintenance on their systems, or, you know, there's an otherwise budget cap or time constraint. And what we have seen over and over is that, you know, advocates can get to a point of, you know, the advocates and the agency agree on a change that needs to happen, and there's an IT fix that needs to be done in order to make that change happen. But it can take several months or possibly a year in order before the timeline for that IT fix can be completed. Financial resources, I think this differs by state, but if you're in a state where an agency has extremely little flexibility with their budget, you know, obviously adopting some administrative changes, if it comes with a price tag, may be a barrier that you're facing. And then the ideological differences. And again, I think this varies by state. This can be very extreme in some states. But I also want to say that regardless of your political climate, I think we find again and again that those people that are running these programs really do care, and they really do want the programs to be efficient and effective, and they're willing to make positive changes. Sometimes it just may not be completely clear to them what, you know, some of those best changes may be. Okay, so moving on from obstacles into the strategies. So I think when we think about the work that Jen and I have done over the past several years with advocates, this is some of the things that really stuck out as critical ways to move forward on administrative advocacy. So one, you just have to get in the door. And this can be, you know, there's a whole spectrum of ways to do this. You could sit on an advisory board if you can get an invitation or an appointment to do that, or attending public meetings of advisory boards in non-pandemic times, giving public comments if that's allowed or required, or really just reaching out and asking to meet. And, you know, if you don't know your Medicaid director or other administrators in the Medicaid program, just, you know, getting to know them, kind of for them to understand what you're doing in your work and see if there's collaboration space there. I think really important is not just to offer critiques, but to bring really strong solutions to the table. And this is where national staff can really help you figure out what some of those examples might be, can help you figure out how other states have tackled some of the challenges, but bringing as many solutions to the table as you can, and then offering to help. I mean, like we said, the agencies are, they're stretched. They have a lot on their plate. So if you're really worried about a certain notice, you know, are they open to, you know, letting you take a crack at some of the language drafting, or, you know, showing some potential new language to clients, and getting feedback that can help the agency finalize that. And just like legislative work, I think engaging a variety of advocacy partners and building a coalition in this work is incredibly important. You know, every group brings different perspectives and value and strengths, and I think particularly engaging groups that are doing enrollment assistance or otherwise working directly with people who are enrolled in Medicaid will bring a lot of knowledge about the barriers and what the on-the-ground experience looks like. And then public communications. I think, as I kind of alluded to earlier, that focusing kind of on the bigger picture in the public space, you know, things like if somebody's eligible, they should be able to be enrolled, that it should be good government, we should reduce red tape. But then, you know, as you're getting into the more concrete details with the agencies, bringing some of the more weedy policy solutions that address those things that are being put out there in public. And then truly, I mean, really understanding the ins and outs of application and renewal. And I think, you know, some advocates have a really, really solid understanding of those, particularly if they're doing enrollment assistance. I think others have kind of a a vague, well, I think this is how it should work, but I don't know if that's exactly how it does work. And there could be a mix in between. But I think really kind of figuring out firsthand what's really happening is very, very critical to this process. And then again, in non-pandemic times, if you have the opportunity to shadow a caseworker for a day, if you have that relationship with the state that they would, welcome you into that space to do that, that can be extremely educational and provide a lot of information that will help you, figure out where your administrative advocacy steps should go. So that leads us to kind of a few of the lessons learned. And we are going to be, the class where I work is going to be putting out a paper later this fall or early in 2021 about more lessons learned from the project that I referenced over the past several years. So we'll be sure to share that out as well. But kind of the big takeaways, it is time-intensive work, but it has really big payoffs. And I think it's something that if you have the resources and the time to commit to, really, really makes significant differences, not only in program and administration, but really directly in people's lives with their ability to access healthcare. New administrations, I think, when your gubernatorial race comes up, I think the new administrations provide a lot of new opportunities or threats. I would say that one lesson that we've learned from the project over the previous several years is that it can often take new administrations longer than, I at least anticipated it might to get fully up and running to a point where they're ready to address some of these barriers. But I think the earlier you can be prepared in a transition time to really take advantage of the energy and new appointments in that time is critical. And also on the opposite side, really having a way to kind of monitor any negative action that could be taken on an administrative level by administrations that would want to do that. And then as I referenced on a previous slide, really, really having a solid understanding of what's happening on the ground is so critical because that coupled with any data you're able to receive from the agency is really going to give you kind of the roadmap of where the barriers are and what needs to be done to reduce those barriers. Okay, so I think that sums it up. I think I'll reiterate what Jen said earlier, that we, this is a really high-level 101 dive into administrative advocacy. We are talking about kind of doing a 202 at some point. So we're really eager to hear from all of you kind of what you would like us to dive deeper into, what you would like to learn. I do have resources here that I think when the slides are sent around will be helpful for you to have at your fingertips. And I think other than that, we are ready to open it up for questions.
Great, thank you so much, Suzanne. We do have a couple of questions. The first question is, how can you do administrative advocacy in a conservative state where politicians don't want people to get benefits?
I think that I totally appreciate the question. So just for context, I'm sitting in Kansas. I work remotely for a class which is based in DC, and I love working with advocates in red states. I did advocacy here for many years. As part of that was under the Brownback administration. And I will say it's hard, right? Like, I'm not gonna lie, like it's hard, but I do think it's a matter of developing relationships with the people who are below the political appointee level as much as possible. I think, they're there working on these programs because they believe in them. They're there throughout different administrations because they want to be good at their job. They, want to administer these programs in an efficient manner. So I think it's both developing those relationships. And I think it's also in more conservative states personally, I feel like it's really important to think about the public narrative and kind of that like overarching, if somebody's eligible for a program, they should be able to enroll. And I think that that's a message that that I think resonates pretty well. So that's the advice I have off the top of my head. And Jen, you're welcome to add it.
Great, so the next question is, where does one start when basic Medicaid data is unavailable?
So I assume basic Medicaid data could be anything in terms of like enrollment to denial codes, kind of that list we went through. I would start with what you can find out from organizations who are directly working with people who are applying for and receiving Medicaid, like whether that is maybe a legal aid organization in your state that's providing services, maybe it's a safety net clinic that's helping people apply when they come in. I think any organization that's directly working with people who are eligible, who are enrolling, they're going to have firsthand knowledge of those barriers that they see most often, and that's where I would start if clear data isn't available. Jen, I don't know if you have anything else to add.
I definitely agree with that. I mean, data is very important and it can help you kind of get to lower levels of what's happening, but you often don't need data to know that the notices are unclear or that people fall off in the middle of their certification period when they pick up an overtime shift. So data is one element, but I wouldn't focus 100% on that, especially if that door is pretty hard to crack open. You can get a lot of rich information about where the barriers are based on client experiences and what you hear from partners, as Suzanne described.
Great, and the next question is, if there is a new federal administration next year, how will that change administrative advocacy in the states?
So I'll take a first crack, and then Jen, you can weigh in. I think if we see a new federal administration, I think we'll see guidance from CMS to states about different options they can do, perhaps. There's going to be a lot going on in terms of when the MOE ends with the COVID pandemic and the public health emergency. So I think if you're thinking about state administrative advocacy in a new federal administration, where my head goes to is, new options from the federal government that states could implement, new guidance, and making sure that your state is taking, full advantage of all the good opportunities that may be presented. Jen, anything to add?
I think there are a couple additional elements. For one thing, I would hope that for state advocacy organizations, they would be able to free up some capacity. I know many of you have done tremendous work over the past almost 4 years in defense at the federal level and at the state level. And if there's a new administration that doesn't present the same federal threat to the Medicaid program that this administration does, that might allow you to engage in more administrative advocacy. And also if you're not defending against things that they're promoting at the state level, like work requirements, like canceling people if there's one piece of returned mail, that might allow you to turn to some more proactive things that would be facilitated by positive guidance from the administration and positive clarifications or reg changes that would maybe push states to more fully implement kind of the vision of ACA, of a full continuum of coverage that's streamlined and relies on data checks more than paperwork, and could really open the door towards implementing that as envisioned.
Great. Our next question is there a good source for state-by-state data on the number of people eligible but not enrolled in Medicaid?
So I see Anne asked that question. So I don't think so, but I'm going to keep digging because this data I was looking at when I was putting this together, I'm going to reach out to the authors and see if they are going to be updating that at any point and if they would have state-by-state data. So I don't know of any to share at this moment, but certainly if we did, that's something that we would share out through the Emmy email list and through other avenues.
Yeah, it's a great question. There's not the same kind of participation rate in Medicaid that there is that's calculated for SNAP. There is information from census data on uninsured and analyses of like what their income level is and the fact that they potentially be eligible for Medicaid. So you can get kind of some discernment, but certainly the level of specificity that there is in SNAP and not a really clean number.
And somebody just commented also that Kids Count has some of that data for children. I'm not sure if that is in every state or not. It's been a while since I looked at Kids Count data, but that could be a source. It wouldn't be for adults, but possibly for children.
Another question we have is administrative advocacy all about an inside strategy, or is there sometimes an outside strategy too?
So I think it's both, and I think the degree to which it's the balance of that really kind of depends on your political climate. I mean, I think my personal opinion is that the greater of an outside game you can use in terms of kind of the high level messaging, the narrative formation around the value of public benefits, that people who are eligible should be able to enroll, I think that helps permeate some of that nitty-gritty stuff with the agency. And I also am hopeful that that would contribute more towards sustainability of successes through different administrations. So I certainly think that it needs to have both components, and I think finding the balance between those two will vary by state.
And I think the other thing to consider is how an outside strategy might affect the inside strategy. So, you know, if you've tried to reach out to administrators and promoted some change and they refuse to take meetings or actually implement what they promised or something, there might be a need to go to a legislator or go to the media to kind of prompt action, but you've got to not use that avenue lightly. You know, that might kind of hurt your relationship with that administrator that you've been trying to work with. And that might be the right judgment call because something really needs to shake this loose and get it moving, but you don't want to kind of do that willy-nilly without recognizing that balance. Similar question when it comes to lawsuits. You know, in many cases, in many states, some things the state is doing is not allowable. And you do have that legal avenue, but you've really got to think hard about what that legal avenue will get you. Just winning a court order or being right that they're doing something wrong doesn't solve the problem for clients. So is that an avenue to push for more state funding for an IT system change or for more case or something like that where it can kind of be complementary to your state strategy? Or if you go that route too often, will the state just shut down and not talk to you because they know that anything they say could be used against them? So it just requires a lot of, you know, careful thought and analysis, but both can be used.
And one last question that we have here. Are there any circumstances when legislative advocacy and administrative advocacy might intersect?
Yeah, absolutely. I mean, I think after legislative advocacy success, there's kind of the long road of implementation, depending on what that legislative success was. And so following that issue through the implementation process is critical. And then I think kind of as Jen alluded to, you know, if you're just not getting traction with the agency, if you're really hitting roadblocks, you know, is there either a legislative angle for oversight, if not actual legislation, or some other pressure from a legislative body?
Yeah, I think I'd just add to that in some cases, the problem that you identify through administrative advocacy and looking at data, looking at client experience may be solvable through legislative work. So in many states, advocates identify churn as a problem, especially between recertifications, because of data checks or because of fluctuations in income. And the solution to that might be continuous eligibility. And in many states, that might have to go through the legislature because it has a cost, you know, it's enshrined in state law or something like that. So it can go both ways. The legislative, you know, advocacy or something you win there might lead to major implementation issues that you need to look at, or you might identify things on the implementation end that would lead you to a legislative solution.
It looks like we don't have any more questions, but if you'd like to ask a question, you can click on the Q&A icon at the bottom of your screen.
If there are no more questions, thank you so much for that great presentation, Suzanne, and thank you all so much for joining us. We intend to schedule the next webinar in around a month, and we're looking to focus on kind of an introduction to applying for Medicaid. So applying for Medicaid 101, focusing on what the federal requirements are around that process, what some state best practices are, and diving into that issue. So watch for an Emmy update that has both the slides and links from this presentation, as well as information about the next webinar. Thanks so much for joining us, and we look forward to working with you on this project. Have a good day.